Blisters. Blisters, mechanically caused blisters, they can be caused through a heat object, something hot, a hot pan or something, so here's advice to be careful if cooking or something. It can come through irritants like metal or detergent. It can come through unusually working with hands when a blister at your hand. It can come through walking with unfit shoes or new shoes or something, and here's advice to when start slowly walking in new shoes, and also change the socks if you walk for a long time. It can come through sunburns, and then that is also dangerous. And it can be also for other causes, so not mechanically caused. It can be when, for example, eczema, shingles, chickenpox, other things, herpes, simple herpes zoster, and so on. Now, normally, if just the epidermis of the outer layer is affected, it goes away within a week. If it's deeper, it takes longer, and it can leave a scar. And if it gets red around, infected or tender, then a doctor should be consulted. And it can make a blood test, it can make a test of a fluid inside of a blister. There are also antibiotics against infections. Now the fluid inside of it is the serum, which is the watery part of the blood, so it takes a bit of time, around an hour after the injury had occurred, until the blister forms. And a blister should not be opened, because then things can come in and it can get infected. If it is opened, here's advice to keep it at fresh air as much as possible, but only in hygienic surroundings. If dirt can come in, then it should be protected with bandages that no inflation can come in, because that can lead to an inflamed sore or an ulcer. And that is according to Keith Hodgkin's Family Medical Advisor book on the pages 91 and 92, but this is no medical advice. Hi, welcome. I'm trying to learn medicine, today blisters, and after we've done it, we're gonna do extensor carpi ulnar strength training. And if you participate in the extensor carpi ulnar strength training, then it's at your own risk. And we're talking about internal anatomy, bones, skin bones, and stuff like that. And also diseases, also blisters caused through diseases. And this is no medical advice. I'm just trying to read the text and trying to understand it. I haven't even read it. I just saw a little bit when I look over it, but I haven't even read it. Blister. A blister is a swelling formed by an accumulation of clear fluid under the skin. So the blister, there is a clear, it is not caused through. It goes along with it. Maybe we mean the swelling. Let's just read it. So a blister is a swelling formed by an accumulation of clear fluid under the skin. The fluid usually consists of serum, which is the watery component of blood. So it is serum, and that is the watery component of blood. So we're going to talk now about blood. That is the watery component of blood. Most blisters occur singly on an area injured by heat, sunburn, irritant substances, or friction. So it can be heat, burning at a hot plate or something, sunburn, the sun, 2-3 hours sunburn, the sun shining can cause blisters, and also irritant substances, so acidic substances, and also friction, walking for a long time. A blister, or playing a hockey sport or something. A blister may also result from an insect bite. Where multiple blisters are present without external injury, they may result from an infection. See cold sores, herpes simplex, shingles, herpes zoster, chickenpox, and impetigo. Multiple blisters may also indicate serious disease. So blisters can also be, if multiple or something, indicators of serious diseases. Now this is no medical advice. I'm just giving you an idea. Blisters caused by injury. Symptoms. A blister resulting from heat, skin irritation, or friction usually forms within an hour of the injury occurring. A bubble of colorless fluid appears beneath the skin, and that is the watery component of blood. It may grow in size after the irritation has stopped and may burst if there is continued friction. So it's growing in size after the irritation stopped, at least for some time. A blister often forms after the pain of the injury has eased. It may be painless itself, unless it bursts. In this case, a lower level of skin or raw tissue is exposed and becomes sensitive to the air. Dirt or other irritants may get in, forming an inflamed sore. A blister often forms after the pain of the injury has ceased. So the meaning by friction and so after the pain is over, don't mean burn blisters. Has ceased after the pain is sometimes come a little bit delayed. And they should not be opened because it can cause pain, because when the raw skin is exposed, and also dirt can get in, and then it can get infected and inflamed. Duration. A blister formed under the epidermis, the outer layer of skin, heals within a week. If the lower level of skin is broken or infected, healing takes longer. So weak if it's just the epidermis, it can be longer. Causes. Touching any hot object such as a stove or iron, so hot objects. Friction. For example, badly fitting shoes may raise blisters on the feet, and unaccustomed heavy manual work may produce blisters on the hand. So walking in unfitting shoes or too much walking can cause blisters at the feet or at the toes or somewhere, or at the heels, and being not used to manufacturing work, to manual works, and it can cause also some at the palm. Exposure to skin irritants such as certain detergents and metals. So some things can also do it. Metals and detergents. Okay, complications. If a blister bursts, there is the risk of infection. The blister may form an open inflamed sore or ulcer. So there is a risk of infection if it is open, and they're saying it can lead to an open inflamed sore and ulcer. They're saying blisters can cause ulcers. I'm searching for quite some time for what ulcers are, where they come from. Let's take actually a look. Ulcer. An inflamed break in the skin or in the mucous membrane lining the alimentary tract. There are many different kinds of ulcer, ranging from the small ulcers that appear inside the mouth to the more serious gastric, duodenal and malignant ulcer. I don't know, but I keep on the search of where ulcers are from, because I don't think it comes just from blisters who have opened up. Nevertheless, if the blister bursts, there is a risk of infection. The blister may form an open inflamed sore or ulcer. Treatment in the home. Avoid any further friction which may cause the blister to burst. So normal friction with the blister is not bursting. Do not burst the blister deliberately unless the taut skin is causing acute discomfort. Opening the sore increases the chance of infection. I don't know what we mean here with the opening. Maybe opening the sore increasing the chances of infection. That is the idea. If a blister does break, expose it to the air as much as possible in hygienic surroundings. Keep it covered with a bandage, however, where there are obvious risks of dirt getting in. So they are advising here, the book is from the 70s, they are advising here to keep it at the air, in the air exposure, but only if it stays clean while it is at the air. Otherwise, wear a bandage. When you consult the doctor, if a blister becomes infected with a swollen, tender or red inflamed area spreading around it. That sounds a bit more like it could form an ulcer. So infected, swollen, tender, red inflamed area. If blisters occur without any obvious cause of injury. What the doctor might do, prescribe antibiotics if a blister has become infected. So antibiotics maybe. If blisters occur without any obvious reason, the doctor may take blood tests or remove some fluid from the blisters to check for evidence of an infection or skin disorder. He or she may also administer a local anesthetic and remove a piece of skin for examination. So checking the blood or the serum in it. Was it water serum? The watery compound of blood. It was serum. It consists of serum. The serum or blood test or something else, biopsy, to look if it's maybe something else. Prevention. Take care when working with heat, when cooking or ironing, for example. So heat sources are dangerous. Wear protective gloves for any heavy manual work to which you are not accustomed. But not every gloves wearing gloves is not a security for not building blisters still. But he is advised that wearing protective gloves can maybe help. And there is also many manual work where gloves are necessary. Nevertheless, how much harm? Avoid badly fitting shoes and break in new shoes with only short periods of time. Put on thick socks to prevent chafing on a long walk. So we're saying wear fitting shoes, and also do we say if they are new, and also don't work too much directly when they are new. And we're saying here thick socks, and I want to add to that place, change the socks. When the socks getting wet after 2-3 hours, you have to change them. That is even more important than thick socks. Change the socks. Don't wear wet one. And they get wet after 2-3 hours by most people. Initial periods of exposure to sun or ultraviolet lamps should be very short. Only a few minutes, and should be increased very gradually. So the sun itself can form blisters, and not just the blisters, also long-term damage. And also ultraviolet lamps can cause blisters. Outlook. Most blisters form only under the outer layer of the skin and heal completely with or without treatment. Occasionally, a severe blister may affect the whole thickness of the skin. It will also heal completely but may scar. So severe blister can form scar. Okay, we have here a little bit more, but the voice is giving up and we don't have time left. That means that was the medicine part. We're going to continue on the next part. If you were here for medicine, you can go directly to the next part of medicine where we're going to read on. If you stay here and participate in the... Did I announce something? We're going to do extensor carpal nerve strength training. If you participate in the extensor carpal nerve strength training, that's what it is. Good and stable standing stance. Arms up, the fists, and bring them down. Yeah. Now we're having 3 rules. The first rule is to stop immediately as soon as there's pain. And our fists and up, down. The second rule is to go only as far as it possible with a little bit of effort. And the third rule is to not overdo it. We just want to strengthen, not to exhaust. You can use a sock, a tennis, no, not a tennis ball. You can use a sock or a t-shirt or a towel. Press with good force onto it and bring the hand again down. And again. And down. And change. Press and down. Again, if his pain stop immediately. And press, and now turn to the outside. Press evenly with all 5 fingers again to the inside. Out. Change, press, in, out, okay, in, and up on top, and down, again up, down, and up, and change again from top, and down, and just press in neutral position and change. And that was the extensor carpal nerve strength training. I thank you very much and until next time.